Hi, I'm Dr. Matthew Norton, the founder of People Plus Purpose, and this is the Truth Behind Dentistry podcast. And today I am thrilled to be joined by two registered dental hygienists who have both found their unique passion and created different career pathways over the years. We have Whitney Crist, an RDA for 13 years, and more recently, the founder of Dentistry Rebalanced, with a specialty focus on ergonomics and a passion to achieve pain-free dental workplaces. She's a speaker, author, clinician, and adjunct faculty educator. And we also have Christine Phillips, an RDH of 29 years and the founder of RDH Pro Connect, where she empowers hygienists to enhance their skills and advance their careers, and also helps dentists foster an incentivized, productive environment for their entire team. Welcome to the podcast, ladies.
Thank you.
Thank you.
Yeah, I've been looking forward to this. This is a little different format, so let's have some fun with it. First of all, both of you have been in dentistry for a while. You have a common background in hygiene, but I'm a huge advocate of exploring reinvention possibilities. I've certainly done this in my life and career many times, but through the whole arc of a career, I think it often is something meaningful, and I would love to have people hopefully be inspired to consider that possibility, maybe influenced by both of you. So I'd like to ask each of you to kind of answer what primarily prompted you to make a change in your work focus, and then maybe also what's one thing that's surprised you as a result of the change. So maybe Whitney, you can start us off.
Yeah. So what kind of prompted me was my passion because of my experience of musculoskeletal disorders because of the work that I was doing as a hygienist. I love dental hygiene. I love connecting with my patients. And at one point, I was thinking that I wasn't going to be able to work in the op again because I was in so much pain. So that really was the prompt of why I decided we need some help here in the dental field with this. One thing that has surprised me about going off and doing something different is there's no really pathway, linear, like step by step. So as a hygienist, it's like, medical history. Then there's, you do the extraoral, intraoral exam. Like there's a 1, 2, 3 of the process. When you're often starting your own business, it's all over the place. So that was kind of different for me and how my personality works. I'm having to adapt to that.
That's great. That's great. It's something you might have suspected at some level, but it's become more clear. And I like the fact that it was a very practical reason that kind of led you to need to make a change, right? So I think that's one common result for people is like, I need to do something different. And then great that your offering is something that you personally experienced a need for. So that's
Yeah,
one.
absolutely.
Yeah. So, Christine, what was maybe there's multiple prompts, but what would you say is primary for you?
I always call it, and I've stated this before, is I state the help factor. Once in a while, I hop onto Facebook and I get onto the Facebook forums there, and you see how a lot of these younger hygienists and even some older hygienists, they just struggle with today's dental world. And some of the things that were put out there, I was like, there's a very easy solution to it. So what I started doing was I just started reaching out to some of these girls on Facebook, and I'll just be like, can I help you with this? So then what ended up happening is I was spending 3 hours a night taking these direct messages from these hygienists. And, someone was like, you're up all night doing this. I was like, yeah. And they're like, well, maybe you ought to be a hygiene coach and get paid for it. And I was like, oh, well, that's kind of an issue. So I had the faintest idea how to start out. So I reached out to a coaching community, and I've actually feel, in my opinion, that I have come great lengths from being a regular dental hygienist and just helping other hygienists, meet their goals in today's dental world. And yes, I'll agree with Whitney. You're all over the place. You're here, you're there. but I'm very impressed by myself that I actually, not only am I a dental hygienist now, I'm a businesswoman, and I never thought I would be able to achieve this. And it's in its infancy, but I'm just going ahead and attempting to shake hands with the right people and just make a difference out there for hygienists nowadays.
That's great. That's great. Thank you. And I'm excited for both of you. I mean, I think this is because you're both still in the earlier phases of your career reinvention, and even though you've been in hygiene for a while, you're still young and have plenty of time to make impact in new ways. So I think it's awesome. Whitney, I'm going to kind of go back and forth with some
Mhm.
questions, kind of more specific questions that pertain to each of you. So maybe we'll go with you to say kind of why your company is called Dentistry Rebalanced. And so maybe why that. You gave us a little bit already, and maybe the motivation to focus on ergonomic coaching, but maybe you can expand upon that a little bit.
Yeah. So the name Dentistry Rebalanced, I came up with that because when you talk about musculoskeletal disorders, a lot of times the theory is it's caused by a muscle imbalance. So when we're working and we're hunched over our patients, our chest muscles are shortened and they chronically become shortened. So when we're working 8 hours a day like this, we walk out of the operatory and we walk out, like it over time becomes like that.
Mm-hmm.
So what I wanted to think of is like, well, let's rebalance. Let's get back to a place where we're in neutral posture. And so that's kind of how I came up with the name.
Yeah, I like it. I think it's a great name. So anything more on your sense of the magnitude maybe of these ergonomic challenges? I mean, this cannot be a small percentage of people that we're talking to who would labor under this. It's got to be like the norm, right?
Yeah. So actually, it's like the latest statistic is 78% of dental professionals, not only hygienists, but dentists and assistants, 78% of us experience musculoskeletal pain. And I'm like, that's huge. I knew I wasn't the only one. So it's a big issue. And so ever since, it was 5 years into me working that I started experiencing it. And then I transitioned into adjunct clinical instructor, so educating, and I love educating. I noticed that my students were also like in pain already, just being a student, they weren't even out in the real world. So I was like, wow, this is huge. Let me see what I can do because I want to help. What we do as dental professionals is so important for the health of the overall body as well. And I didn't want anybody to cut their career short because they were in pain.
Yeah, yeah, it's kind of like they tell you on the airplane, right? You got to get your oxygen mask on first before you can help anybody else. So if you're dying over in the corner in misery, then it's going to be much more difficult to help others. So I think that's great, and great motivation to just move in a direction like that. So Christine, what are maybe one or two common misconceptions that you have come to about hygiene? This is truth behind dentistry again, right? We're already revealing that people are in pain and need a change. And then how do you address some of those misconceptions with your clients?
Well, it's definitely a different world out there than when I first started. It has Dentistry has propelled to unsurmountable aspects. So the one thing is the no one cares factor. So you always hear people like, oh, no one cares about this anymore. No one cares about if I work over my hours. No one cares if I don't have the right instruments to do this. And they're actually, I that's what I want to tell people. Like, there are people that care. Not only Whitney, but there is a vast dental hygiene coaching community that's out there, and we all have our own little unique, you know, divots that we're in. And as much as, everybody's like, oh, another hygiene coach, but the funny part about it is Whitney does ergonomics, and stuff like that. Me, I want to propel you with mindset. Set your mind the correct way so you can function in everyday dental world, as I call it. And not everything is a catastrophe. Not everything is a, oh my God, how am I going to get over it? Like there is a solution to it. And I just want everybody to know, like dental hygienists and dentists out there alike, that there are solutions to these simple problems if you just sit down and focus in the right mindset. Just don't, they're just so quick to act on a dime and put feelings into it. But if everybody would just stop and think about it and then act, things would be a lot easier. And in the dental world, people wouldn't quit their jobs, hygienists, assistants, and be like, I'm out of here just because, I don't like the tile on the floor or something like that. There's so many things you could do to retain your positions and be happy. And if people would just give it an opportunity, it's out there, in my opinion.
The one key misconception then would be that there's only a limited range of what's possible, and if we're struggling and feeling like nobody cares and don't see a pathway through that's not true, that there are more answers than people think and more options for maybe how to reframe what you're doing.
Exactly.
Yeah.
Exactly. Perfect.
Any
And
other kind of key, like top misconception that you might want to throw in with that one?
the other thing too is I'll address it from like the dentist point of view. So I've heard this a lot lately that everybody's, everybody kind of boxes dentists in one thing, and dentists always go, hygienists are all alike. And it's like, no, they're not all alike. We all have our certain caveats to us and everything, but a lot of us, especially these new hygienists, if they just would have guidance, we could bring them up to the speed like Whitney and I are at the moment in time. I always say it's not the fact that you're not a good hygienist, it's just you just don't have the experience right at the moment in time. And I think some of these hygienists are just so propelled into these, especially younger hygienists, into these positions, and the dentist expects them to perform like Whitney and I would perform, but they're just not at that level yet. And that's why I'm hoping to come in, and that's why I shifted also to the dentist and say, hey, look at, let me come in, let me see what's going on, and let's see if we could catch everybody up to speed. Not only dentists, the hygienists, but even the front desks, even assistants. You know, I'm really I'm ready and willing to do this to make things better. So, I really don't want to be replaced by a robot or, saying, oh, I don't need hygienists anymore. I'll do it.
I don't know any robots at this point that are going to replace you, Christine. So I think you're
Yeah,
I
thank
think you're
God.
I think you're covered there. But I agree that it's kind of naive to think that anybody's going to come out of school and be prepared and equipped, any more than dentists really are coming out of school fully prepared and equipped to take on the world of business and leadership and all of that, right? I think everybody needs some coaching and mentoring, no matter what their position and no matter what the particular challenges are, like the ones we're talking about today, for example. Whitney, how has your journey been shaped, would you say, by the larger hygiene community? And what role do you see collaboration playing in your approach to business?
Yeah, so Christine kind of touched on this when she talked about the mentoring aspect. It's a huge, huge component. As a hygienist, you can kind of feel isolated a little bit. Like I was in an office and I was the only hygienist for the longest time. And day after day, you're with the same people, which is wonderful. I got along with them, but I needed more. I needed to connect. And so I got really involved with my state association, Dental Hygiene Association here in Nebraska, and watching and getting to know those leaders. They were my mentors, and they were doing some pretty cool things, starting their own businesses, getting into leadership on the national level. So being able to see that and knowing that that was possible for me because I knew them, and they saying, you can do this too, gave me the confidence to be able to start my own LLC. And so I don't think I would have been able to do this if I didn't reach out to other hygienists. I'm going to bring that into my business going forward and really connecting with like-minded people. It just makes a big difference in growing yourself, helping others, and growing the business.
It's awesome. Yeah, better together, right? We can be better
Mm-hmm.
together.
Yes.
I mean, that's a kind of within people plus purpose. That's one of the perspectives that I'm always taking is who are all the unique people that are involved, from starting with the business owner, leader, and then out from there. Everybody has uniqueness. And also, I was thinking as you were saying that, how what we all notice and what inspires us to step forward and maybe do something different, try something different, bring a unique voice into the community, has a lot to do with the things I'm measuring in the assessments. Many of the listeners know about the assessments. That probably heard me talk about them before, but one of them being inspiration sources. There are a number of different motivational or inspirational factors that have been reasons why each of you have opted to do different things and to find unique fulfillment for yourselves in this. And other people who are listening, who may not want to do exactly what either of you are doing. There's so many other things. And how do they find that? Sometimes by being able to tune into what's in me that I uniquely value and want to contribute. So you've got me inspired already, both of you. So this is
Oh, did we just lose her?
we lost her. So
Oh.
hopefully she will come back here shortly. Let's go ahead and go into another question for you while we wait and see. Maybe you can share some common ergonomic issues that you feel like dental professionals are facing and how your coaching is addressing them.
Yes. So, I mean, I kind of spoke a little bit about this, significance of musculoskeletal disorders in dentistry. Like 78% of us are experiencing pain. And so what ergonomics can do is help with that. And so we've got neck, low back pain, shoulder pain, upper back pain, wrists, like it's all over. So when I go in and help clinicians, what I like to think of it is like I'm their like personal trainer for ergonomics. I'm there to help them. So I can objectively look at their operatory and their habits, their setup, and then give recommendations to help change, whether it be like products or maybe the chair placement. Even I go as far as like, hey, don't forget to tuck that chin down when you're working on the, lower mandibular linguals, things like that. Because as you start practicing, you get into a habit, like doing the same thing. And so me coming in is kind of like one of those things where it's like, you can do this, this, and this. Like, how do you feel about that? And they're like, oh yeah, I can do that. It's just so fun and rewarding to help people.
That's great. I love your enthusiasm. I mean, I just feel you come alive when you're talking about this. So you've got a great smile too. So I can just see you being winsome in these environments. And I'm hoping that people are responding so far to your offerings in this to go, I appreciate that input. And because we don't see, right? We need somebody else to see things that we can't see. We're in the moment and not noticing what we're doing. And I'm curious too, as far as the dentists as well, right? I mean, you come from a hygiene background,
Yeah.
but it's not just hygienists in the dental office. The dentists also have these challenges. So what's your focus there?
I will admit, like, because I am earlier on in the business that I have, helped some dentists, but it's not as familiar,
Mhm.
and I wasn't a dental assistant before becoming a dental hygienist. So I kind of look towards the dentist that I'm friends with. I'm like, hey, what do you think about this? And that kind of thing. And they're very helpful, but it is, in hygiene, I'm like, I know what I'm doing. Dentistry is a little bit more challenging, but I'm up to learning and going in there and doing all that I can to help because dentists are in pain too.
Yeah. Well, I can see it being a journey over time.
Yeah.
Uh, Something prompted you, as we were talking about, to start, but where the journey leads you and the impact you can have. I mean, I just can't imagine this being anything but a huge opportunity because the needs have to be so great. I mean, I know from conversations I've had how many different hygienists are considering reinventing themselves in some way for the exact reason that you're talking about. I either can't keep doing this much longer, and I also do have dentists tell me that too,
Mhm.
or I imagine down the road that's coming, and therefore I need a plan. I need to consider things. So pretty inspired by, I'm sorry we lost Christine there.
I
Maybe
know.
not sure if she's going to make it back or not, but I'm really inspired by the conversation. Look at possibilities, because I'm all about people being liberated from where they're stuck and where they need a breakthrough. And a lot of times we don't get the breakthrough because we don't even know what was possible.
Yeah.
I mean, there's possibilities that are showing up in this conversation for not only for the hygienists as to what they could do differently career-wise, but also what they could, as long as they're still in the game, like, I need this, right? I need to be better.
Yes. And I think it reminds me of my husband and I met with a financial planner. I think it was 1 year after I got out of hygiene school. And so he was talking about the long run. And he was like, well, when you retire when you're in your 60s, and I was like, whoa, hold up. Like I even knew then, I
Yeah.
was like, I won't be a hygienist at that time because it's so hard to, as you go on, you just can't physically do it. But I loved it so much. And I'm like, I want to make an impact so that those hygienists that do love it
Mhm.
can continue to do it.
Yeah, that's great. That's great. And I think, I know for myself that after a long clinical career, I never stopped loving patient care. But I think for many people too, it can be that there are other calling elements on your life, either because you see a great need, specific need, or because you're just feeling something inside you that you want
Yep.
to deliver that's different. So it
Yep.
doesn't have to be that you're have become miserable or think I don't love it any, I'm in pain or I don't love this anymore. It could be that there's other contributions that you can make based upon who you are and what your life experience has been. So I think
Yes.
I just kind of want those that are listening to us to sense a range of possibilities for what might motivate them, and that there's a world of things out there.
Absolutely. I completely agree. And, I I felt something inside, like this is my calling. And so for anybody listening, you just kind of have to follow that. I've taken a slower approach. Like this, it was in 2020 when I realized that this was something that I wanted to focus on. 4 years later, I'm still in the beginning stages, and that's okay. But I just knew like this is where I needed to be in dentistry. And so, yeah, you just got to take little baby steps to reach towards your goals. And it might not look like what you initially imagined, and that's okay. But what's right for you is right for you.
Yeah, that's great. That's great perspective, I think, to give, because a lot of times we're not in a place where it's not wise to stop doing what you're doing and to then say, okay, now I'm going to start this brand new thing because it's more work than a lot of people might want to say. But I think,
That
go ahead, go ahead.
it's funny you say that because in 2020, when I realized, this is what I want to do, I was 7 months pregnant, waiting for like a doctor's appointment, checkup or whatever. And so like that's why it's taken me a little bit
Yeah.
to get to where I am today, and I wouldn't have it any other way.
Yeah, lots of factors, right? I wasn't even
Yes.
considering that factor, but another
I was like, why now? I'm
right,
like,
yeah.
why now? But
Right, yeah. It's not always a convenient time to start, but it always I've used the analogy before of like a lot of times they'll build a new baseball stadium, say, for example, in the parking lot of the old one. Not always there, but they're always they have to keep the current one going, right? Until the other one's ready. We've got fans, we've got business, we need to keep generating revenue. And so you're continuing to do whatever you have going that's meeting the variety of needs while you're building something else. And then when that's ready, then you can find whatever kind of combination or transition
Mhm.
makes sense. But a lot of times people don't start because they're thinking, oh, I need to be equipped to make this radical transition. And that rarely makes sense, I think.
No, and it didn't make sense for me either. So I'm a very linear thinker, and like I mentioned, like, being on kind of all over the place is newer for me. So, just kind of coming to peace with that and being like this and having a faith that this will work out is important.
Yeah, very nice. Well, I'm so glad to meet you. I'm so glad that you came on. And is there anything else I didn't ask or you didn't get a chance to say that you'd like to share before we wrap up?
No, I really appreciate the opportunity to like come on here and show others that it's possible to start your own business, to do what you love. And I'll connect with Christine later and hopefully we can connect some more. And I'm excited to learn more about what she's up to too.
That's great. That's great. So for the dentists and the hygienists, and maybe anybody else that's not either of those categories that are with us, what's the best way for them to connect with you to find out how dentistry rebalanced can be of help to them, or if just
Yeah.
find out more?
So if they wanted to go to my website, www.dentistryrebalanced.com, they can check out, more about it. And then they can also find my email and a Let's Connect button, that kind of thing. So,
That's awesome. Well, I'm going to encourage everybody to do that because
oh, thank
what you're
you.
offering is very meaningful, and I think they should at least find out more. So I
I
really thank you for
appreciate it.
joining us, for your time today and your contribution. And I'm excited for where you're going with this. And congratulations on the child as well, since you brought that up.
Yeah, it's my third. So like,
Well,
yeah.
congratulations on those three.
Oh gosh, they keep me busy, but
I
lots of
bet
love.
they do. I bet they do. So I thank you for joining us, and also thank Christine Phillips for joining us for a while. And hopefully we can have her back at some point to kind of help finish that conversation. But yeah, thank you everybody for watching and adapting as we've adapted to the shift in conversation today. Hope you found value. And I've been with Whitney Crist and Christine Phillips, and look forward to seeing you on the next episode. If you haven't subscribed, please do so, and please share the Truth Behind Dentistry podcast with your friends. See you next time.